Tell me a little bit about yourself. This is what shaped me. Because I think that's what the question's asking. The question is asking what has shaped who you are and sitting in front of me. So less about the experiences. I went to this school, I got this degree, shape who I am, reconciled who I am. I think those are key. And I think for psychiatry, that's what we want. We want to see what has developed you, what has led you to be who you are. I really want your values, more of who you are as a person. Welcome, my name is Dr. Moss. I'm going to be a program director at this program. Tell me a little bit about yourself.
I'm a fourth-year medical student for my undergrad, received a Bachelor of Science in Biology and minor in psychology as well. I am a 1.5 generation immigrant. I've lived in the US a lot longer. It's a weird blend of both of the cultures that I've had to grow up with, and that kind of has shapes a lot of who I am today. I grew up in a family immigrants. My parents moved here with me. In terms of hobbies, I like to delve into different types of hobbies. I like exploring new hobbies. Currently, I'm learning how to bake, how to crochet, how to knit. And now that I have time to read books for fun, I'm doing that as well. I'm kind of all over the place in terms of my hobbies because I like to explore new things all the time. But yeah, that's a little bit about me.
Awesome. I really liked that you started off by giving me a picture of your cultural background. I thought that was really unique. I love the 1.5. That is something I will remember because it's so I've never heard of it that way. And that's what you
Yeah.
want. Something that I want to remember, something that I don't know if anyone else will say that. Like that you took me through kind of a story. I missed a lot of who you are as a person. I felt like it was more not necessarily CV, but more almost like a chat GPT version.
Okay.
I really want more of your values. Maybe not so much psychiatry, because we're going to talk about psychiatry, but more of who you are as a person, maybe what drew you to these hobbies or medicine or your minor and major in biology, like things that will really set up the entire interview. Specifically for psychiatry, the questions feed off each other and are less question you answer, like they're less pre-prepared and they're more let's have a conversation. And so you say something, I'm going to ask you something after to go with what you just said, because that is more a psychological, psychiatric way we do things. That makes
Got it.
sense.
Yes. Okay.
So I've noticed that as I'm interviewing people sometimes as psychiatry because other specialties are not like that.
Yeah, I get that completely. I think that was one way I had thought about answering that question. I also wanted to delve more into me being an immigrant part of that shaping who I am today because I wanted to elaborate on that, but I was like, I don't know, if I should just answer that in the follow-up questions. I wanted to give a more surface level topic for them to ask me questions about.
Yeah.
If that's what they want for me to be more in depth about it, then I wanted to talk more about being an immigrant, struggling to combine both cultures together because I came at an age of 8 years old. It was really difficult for me to combine what I knew growing up for the past 8 years of my life and then this very, very new, different culture and kind of blending it together because who I was at home was unacceptable outside and vice versa. And so there was a lot of internal struggle with that. And so that kind of shaped who I am up until medical school, until I applied to medicine. I needed to figure out how to reconcile these two cultures together. And as a result, do the same in understanding other people as I was growing up. And so that's why I was like, I could delve into all of that, but I don't know if I have time to say all of that and tell me about yourself kind of question.
Mhm.
I don't know which one's
I
better.
like the statement that you said, this is what shaped me. Because I think that's what the question's asking. The question is asking what has shaped who you are and sitting in front of me.
Got it. Okay.
So less about the experiences. I went to this school, I got this degree, and more about what you just said, just shortened. And I think as you say it over and over and over, that'll
Mhm.
get shorter and you'll be able to get out the stuff that is less important or less
Right.
and to just really get to the meat. But I think the word that you said of shape who I am, reconciled who I am, I think those are key. And I think for psychiatry, that's what we want. We want to see what has developed you, what has led you to be who you are,
Got it. Okay.
who you are versus just what I see. Does that
Mhm.
make sense?
Yes.
Do you
Okay.
want to practice it again?
Sure.
So tell me a little bit about yourself.
I am a fourth year medical student. I am what they call a 1.5 generation immigrant because I was born, lived there for about 8 years before moving to the US at 8 years old. That experience has really shaped who I am today because I had to reconcile two very different cultures. Where I was at home was really not acceptable outside, and vice versa. At home, I was very studious, very rigid, ABC kind of person, very organized. And in American schools, especially younger, they promote more creativity and more flexibility. And I felt like that was something that I was just not used to. And it allowed me to sort of overstep the boundaries that I knew in my own self. But when I brought that same kind of mindset home, my parents would be like, oh, you need to do this and this and this way. And so it was very difficult to reconcile that growing up. As I was developing my sense of self, I learned how to reconcile those things and say both of those things have good parts, and that's okay to coexist together. I still have the parts of me where I'm very driven, very motivated, self-functioning, independent. But I also have those parts of myself where I'm very creative. I like to delve into different things that shows up in my hobbies outside of medicine and exploring new things. Reconciling those two cultures together was one of the hardest things to figure out, but also the best things that I figured out for myself in discovering who I am today.
Love it. That was so good. I think you can still be shorter, but that will take
Yeah.
time. Beyond that, perfect. I love that. I like that you even talked about the concept of your hobbies without specifically saying what your hobbies are. I liked how you said at the end, like, I learned being more interested or trying new things. Yeah, I think that's what you said, trying new things without specifically saying because it brings in so many other things. Well, what things have you tried?
Yeah,
Or stuff like that, or how will you do new things at our program?
got it. Yeah.
I love it. Okay, perfect. Now, why have you chosen to do psychiatry versus other specialties?
So my journey with psychiatry starts very early in medical school. I came into medical school not really exactly knowing what specialty I wanted to go to, but I wanted to keep my mind open. When I first came in, I had a little bit more of a rigid mindset in terms of how I addressed my mental health. My relationship with my mental health was not the best because I grew up in an immigrant family where mental health subject was very, very taboo. It was very much powering through emotions without actually processing through them during difficult times. During my first year of medical school, a lot of life events happened along with the rigors of medical school. So I ended up taking a year off in during second year of medical school. And I took that year to really develop my new relationship with mental health and really processing and learning that it is okay to feel these very strong emotions that demand to be felt because the more I suppress it, the more it will surface again much stronger. I took that lesson, went back to medical school the year after, learned how to better manage stress. Life sometimes happens, and I need to learn how to manage that along with everything else that's going on in my life. And so I really thrived in medical school after that instead of just surviving. I became really curious about learning about other people's mental health, how they experience certain emotions, go through and manage their own mental health, and how I can be contributing to that as a healthcare provider. And throughout my third year clerkships, I kind of realized I really enjoy getting to know people, getting to know their stories, and having that be a part of the treatment plan. Once I got to my core psychiatry rotation, I was like, oh my gosh, it all makes sense. Of course, I really like psychiatry. And so, yeah, that's how I ended up choosing psychiatry as my specialty.
Amazing. I love how you walked me through your path. I'm talking about psychiatry, but then I got it. And I really liked how you brought it in of thriving versus I was surviving, not thriving, and learning about your own and taking the time to address your own health. And now you care about other people and you are thriving. I love that. My question to you, though, is obvious. Right now, we're practicing friend and program director. Are you planning to tell people that you took a LOA who don't know that you took an LOA?
I'm not opposed to talking about it. I would assume that people who only really ask me why psychiatry, that's where it would come up, or like tell me about a time where you dealt with a very difficult situation. Maybe that's one of the questions where it would come up.
Mm.
If it's more like, tell me about your weaknesses, tell me about your strengths. I don't think it'll necessarily come up in those kinds of questions, but I'm not opposed to like talking about it if, they don't know, but then it's something that would contribute significantly to a story I'm telling.
Okay, that's all I care about, that you've had that thought because you don't have to.
Yeah.
And not all of them know. Very few of them will know. So whatever you are the one bringing to the conversation, you're the one bringing it. And same thing with you struggling with your own health. I love that you said it generally without giving a diagnosis or being specific on what was the problem. What you did was really important, and exactly what I tell people that they should do is broad, but it still explains it. I didn't need anything more. You're providing the perfect amount of information that I need to know and still explaining what you got out of it. And I think that was perfect. I just wanted to make sure that I brought that concept up, that you were empowered to sharing that information.
Yeah. When I was interviewing residents, they didn't ask me a lot of questions that related to that. So they don't know that I took a leave. But the program director did. And then I think the assistant program director did. So that's like where the people who actually probably read through like all the resumes and the application, they probably are the only ones that'll end up telling my legal.
And even if it's important, then they'll bring it up. Most likely it won't be, unless they want to know more about it.
Yeah, for sure.
Oh, I really like that you said stories as treatment plan. I never heard that sentence, and I'm stealing that sentence from you. I love that. Understanding it through the stories. Beautiful. I just wanted to say that I love that sentence.
Yeah, I like even remember in family medicine and internal medicine, like the way that their story is, like in their background is, it really just influences what kind of treatment are best for them. It's like, well, maybe because they've like gone through this type of family and background that they're not as open to this type of treatment. It's a very personalized thing that I really liked connecting with patients in that way.
You know what? And that might be a further question is what does that mean to you, stories at treatment plan? I think that was a good way to address it.
Yes.
Next question.